So when David first approached me to say something at Radical Stats Conference on, the data that we've used and how I've kind of engaged with the data, I thought, well, that's easy. In as much as obviously I spend several hours a day looking at the data and looking for patterns, looking for things that are in there, and then of course communicating that with the public. But actually, it's been really good practice to just step back over the course of a few days and a few weekends to consider, well, actually, what has that data journey been, and what are the things that kind of bother me, both in terms of not just the data, because I'm not going to say an awful lot about the kind of technicalities of the data, but how the data really shapes that public narrative and the public discourse around COVID and what it all means. Also acutely aware that because of a work network outage this morning, which was planned, I only saw a little bit of the conference, so I missed Jen Badham's presentation, but knowing, talking to Eugene Milne, the DPH for Newcastle, they've done some fantastic stuff up there. So I'm slightly nervous that I'm going to get to the end of the presentation and the take-home message that you'll have is other places other than Leicester and Leicestershire are doing this really much better, but we'll see who we get to. So on to the next slide, if that will come on, behave. There you go. I resisted the temptation to say too much about Leicestershire. Sort of every presentation I've ever known always has if it has a place-based sense to it, always has a sort of map of Leicestershire. Just one or two things. The Dog and the Fox is not the name of an actual pub in Leicestershire, although it might be. It is a reference to our corporate logo, so recognising, as you can see on the road sign, that Leicestershire is the heart of rural England, obviously got a bit of a hunting background. So the County Council logo is a fox on the L of Leicestershire, but colloquially known to all and sundry as the dog on the log, so hence the Dog and Fox. The heart of rural England, there is a link as to why I put that up, because I will come back to that later on in terms of us summarising where we've got to with data and our understanding of public knowledge. But essentially Leicestershire, the bare bones of it, yes, we are in the middle of the country, 800 or nigh on 800,000 population. It is a two-tier authority. I work for the County Council with my 7 district council colleagues and 2 CCGs across West and East. And again, of relevance to our coronavirus story is the fact that we are a donut around Leicester City Council. And me, as Diana said, I've done various things in my career, but I've now been DPH for Leicestershire County Council for 7 years. In fact, it was 7 years on Monday, I think was the date of my appointment. So there you go. Going to start just by doing a little bit of scene setting, if I may, in terms of the sort of Leicestershire journey, if you like, around COVID. Hopefully, I know that's a little bit small, but hopefully that says something about our journey. So the orange line is the England incident rate, case rate per 100,000 of COVID from the start of the pandemic through to the present day. Green is Leicester, the sort of browny colour is Leicestershire, and then red, which is the other place for which I'm Director of Public Health, is Rutland. I suppose the key points there, I don't know if you can see the cursor. Here is the first wave, going through until sort of mid-May. Then that green peak heading into the end of June and through July is, of course, what will be a central part of the story I'm going to tell you. The Leicester Lockdown, when Leicester was the first place to go into local restriction. Then, of course, we have the glory days when rates were very manageable up until, the 1st of September. I would argue that that wasn't really schools going back that knackered that, but of course, our rates started going up on August Bank Holiday, which was, of course, the last day of Eat Out to help out. And then you can see how the case rates have risen through the through November into the second lockdown, then a dip as we were in that second lockdown, and then that huge spike driven mainly by the Kent variant in over Christmas and into the new year. And then the progress that we've made, steady but slower, I guess, than maybe certainly in Leicester and Leicestershire over the course of the last lockdown. And
Excuse me, if you could put it on the slideshow option, we'd see it larger.
Indeed. Thank you.
Thank you. Thank you.
Although you may need to use your mouse and the right click to advance it that way.
So then move on. No, that's okay. Is that better?
Yeah.
Excellent. Thank you. And at the risk of a spoiler alert, I guess the first point I would make is there's a spoiler alert being, I mean, it has, data is a journey, much like appearing on Strictly Come Dancing. That data has got a lot more sophisticated and a lot more available to us. But if you look at the difference that that's made to our case rates, that you might argue on a more naughty day, that the more data I have at my disposal, the worse I get at my job, because clearly it's made absolutely awful difference to the case rates in Leicestershire and Rutland. I don't really mean that, but it's a bit embarrassing to look at that graph. But in terms of using that graph then to illuminate a COVID story, it is a bit artificial to say the least, but it does kind of fall for me into sort of three different areas. We have the first national lockdown, which with hindsight was really an age of not quite no data, but certainly a paucity of data, both of which I could use and which we could communicate to the public. The local lockdown coincided one way or another with the dawn, if you like, of decent area data, both for internal use and then in the way that we could communicate that to the public. And then really that's more of a kind of movable feast, but the run up to the second national lockdown onwards, I would recognise as being a transition from a famine of data, if you like, to a veritable feast. But there is still, hence the buts, a number of issues for me which remain in terms of using data and indeed how we use that data in terms of a discourse with the public. So the first national lockdown, the age of no data or paucity of data. I haven't got any slides with this one, but I just sort of jotted down a few reflections. You will recall as well as me that during the course of lockdown, we had the ending of I forget the exact date of the kind of trying to keep tabs on every single case and test every case. So actually the amount of data that we had available to us locally was limited. There was the Pillar 1 testing data, so the tests that were still being carried out on those that need to be clinically prioritised, those admitted to hospital. And as a blunt instrument, of course, we'll all be aware of, and still goes on, the daily reporting of death data. Other than that, I was looking back the other day thinking, well, what did we do as a team back in the first wave? And actually, it's the last bullet point. We were hugely busy as a public health team dealing with the minutiae of PPE guidance, PPE ordering, prioritising what tests were available to us outside Pillar 1, dealing with myriad queries from from schools, from workplaces, and indeed from the public. But actually, the work that we were doing was very much focused on issues, very much focused on the kind of managing the national lockdown and coronavirus. From a numbers point of view, I can remember, obviously, as we tick towards the first anniversary of the lockdown and the first case in Leicestershire, every time a case went out, I'd have been out there going, it's the first case in Leicestershire, we have another 3 cases, here is the 5th. But there was no reliable data, if you like, that charted the spread of coronavirus within the first wave, certainly outside of the Pillar 1 numbers. And much as I would always say to my elected members, for instance, that what testing data we had was just a snapshot of the true cases. Of course, people don't hear that, so they tend to focus on the numbers. So very, very different world from where we are at the moment. You would argue that actually in the context of the fear factor of COVID and the first national lockdown, and just generally where we are in terms of the use of death data as a very blunt instrument, it did have an effect. To be, you could argue that just concentrating on deaths and not giving an awful lot of detail put the fear of God into people. And as you know, we probably had a much better reserve lockdown than we did in the second and third national lockdowns. But it did sway things, and I still get questions along the lines of, why does X place have a higher death rate, or has had a higher death rate since the start of COVID than elsewhere? But given death data, particularly in the first lockdown, trying to tease out the patterns and do useful interventions in the community was difficult, because essentially you may as well just said that certainly on the district council level within Leicestershire, it's a map of care homes. Those places which had a higher number of care home beds in the district are associated with higher numbers of deaths, and that essentially crowded out a lot of other thoughts that may have been going on. So that one, we're not data free, but we certainly did not have an awful lot of data. And in terms of using that data to communicate with the public, very little. And actually, if I reflect now, I've done far more comms and engagement and media work since we've had more data available than I ever did during the national lockdown. Essentially, it was universal communications only. So moving us on then, this is a bit movable, I say, but if we head towards the end of June, I think the lockdown in Leicester came in on June the 29th. by happen chance, really, it also coincided very nearly with the dawn of decent geographic, decent area data. As I say, it didn't all start with local lockdown. We did start getting some initial contact tracing data once contact tracing was stood up. I do now forget the date that we first started getting very raw data, literally the number of people that had contacted an NHS test and trace, the number of contacts that each case was then associated with, and how successful they were at contacting those contacts. But that was enough to start triggering a few more conversations with colleagues along the lines of what is going on. And of course, Leicester Lockdown is more a story of Leicester City as opposed to Leicestershire, but I'll come on to Leicestershire a bit. But I can remember a sort of telephone mobile conversation on my driveway with Ivan Brown, the Director of Public Health for Leicester City, one Sunday afternoon, when we were both looking at that very raw upper tier data, and you could see then that there was more activity through test and trace, and I'll leave it at that, in Leicester and Leicestershire than there was in other parts of the East Midlands, and certainly more in the East Midlands than there was in London. So very sort of baby steps, if you like, towards getting a better understanding of what was going on within our patch. That then became slightly more granular. It went down to district council level, the lower tier of local government. But I would argue then that the actions that we had around it was really, again, limited to initial conversations around what is going on, and then a conversation, if you like, around comms to do with particular areas. And I'll come back to area-based interventions in a mo. So on to local lockdown. I think one of my proudest moments, I think, was on the Monday morning that lockdown was then announced in the evening, after Priti Patel had announced that Leicester, we may have to consider things, or whatever it was she said on Andrew Marr on the Sunday morning, was I did refer to on a Radio Leicester interview that this was a Chekhov's gun. And if the idea that we're being threatened with local restrictions would probably inevitably mean that it would happen, it is a proud moment to get a 8:10 in the morning reference to Chekhov into a BBC Radio Leicester interview. I cannot actually top that one, but that's just by the by. So it is seen as being a Leicester City thing, but as it says down the bottom, there were 100,000 residents, notably the borough of Oby and Wigston, which is in my patch, but also bits of Blaby, and which is to the east side of Leicestershire there. Like west side, and bits of Charnwood up to the north of that red ring that also got dragged into the boundary. Now, I know, based on those conversations that we had with Public Health England colleagues, that that line was based on the best data that we were going to get, because there was a number of conversations which were highlighting where there were hotspots, where there was increased numbers of cases in that whole area. But like any line, you are a little bit of a hostage to fortune about where you go. And I guess moving on to the next slide, inevitably this happened. So I would argue that everybody would get that prevention is better than cure, and that the virus respects no boundaries. But in the absence of being able to communicate with the public in advance of the line being drawn, we're always on the back foot in terms of explaining why the line went where it was. And whatever you do, you can't really get over the fact that a line is going to be arbitrary. Now, I would still say that the line was a best fit that used bits of natural geography, like the M1. It used bits of administrative boundaries on the other side of Leicester and Leicestershire. And at its heart was driven by science, because it certainly fitted with the data that Public Health England were sharing with us, which we then didn't quite have access to, and we weren't able to share with the public. But nonetheless, like any story, like the poll tax down through the years, you spend this much council tax on this side of the tail, and you council taxes this much on the other side of the road. Inevitably, it was reduced to an area-based conversation. Leicester Lockdown, boundary line branded stupid by residents. And these were just some of the emails that I had a happy evening a few days ago digging out. So I believe, again, in the absence of that data, I believe the use of the M1 as a convenient line for the boundary is misguided, ill-informed, not based on science or statistics, etc., etc. Instead, it was thought as easy to draw by a team working late at night and under pressure, who then had to develop some highly dubious reasoning for this decision. Well, under pressure, yes. Late at night, no. Without any science, well, actually, there was science behind it. It's just communicating it was the problem. Next one. We expect the authorities to know what they're doing, which is clearly not the case here. Thank you, that kind person. And even better, one that I received late on a Friday night, better run and hide before the people of Leicestershire and Oby and Wigston find you tonight. So the main point I suppose, in terms of that one. Oh, actually, but I should say there were some nice ones. So if I put aside the data and then engaged with the public, there was some really good understanding coming out in some of the emails. So we, actually getting into behavioural science, we've noticed that the young and old are not observing social distancing, that they're not wearing, how you're going to bring it under control unless you deal with that. So there's almost a disjoint between data narrative, the boundary is stupid, and the more qualitative analysis where people actually were engaging really about people's behaviours. But nonetheless, sorry, I'm going on to that slide. But nonetheless, there's an issue which I'll come on to when I summarise this section, which is about losing the battle if you're not able to get the data out to people in advance. And I would say that with the lockdown, the early days in my inbox was full of people who didn't understand why they'd been brought into lockdown. At that point, you are on the back foot. We were at least able in that week, it was the same week that we were then given access to line list data, detailed data, which enabled to put together a data report that we could share with the public, doing little things, even like showing the age of COVID cases in Leicestershire. And the difference between the first wave and Leicester lockdown is apparent here, because as you would expect, the population pyramid of the clinically prioritised cases on the left massively skewed towards older people. Whereas actually being able to communicate to the public around where cases were more prevalent outside of hospital admissions, which is the pillar 2 case on the right, you can see much more prevalent in younger people and the working age population. So that was the start of being able to describe something about age. And similarly, I wish we'd have had this in the day of lockdown. This is the latest one. So this is our fortnightly rate of cases for the MSOAs within Leicestershire. I won't go through it in detail, but that pattern has been the same. Now, people might disagree with me. Leicester City is the white patch in the middle, which we don't know, as I said before. And if nothing else, the truism that the nearer you are to the city, largely, the higher your rate is. If we'd have had that in advance, I think that would have said something to people that would have helped them to understand why the lockdown included bits of areas that weren't just within Leicester City. So the starting point of fairly basic data, because we're only talking case rates by age band and by MSOA, was the start of trying to open up a narrative with people around areas. So, but just to summarise some of the thoughts on local lockdown, I've laboured this point, but data in advance builds confidence in actions taken. Sometimes you just need to take action, but I think it's an important bit around the use of stats. Trying to play catch up is difficult. But then all the way through, I would argue that what we've concentrated on is an area-based narrative, and it still carries on. I think at yesterday's press conference, whoever was minister was fronting it, turned to Jonathan Van Ham and said, he will take you through the geography. Now, I don't know if this is healthy, I don't know if this is an obsession, but there is something in my mind, which I'll come on to, which is if we just talk about area-based data, it drives, to my mind, a narrative in people's minds, which encompasses a few things. It encompasses a fear of the other. So for OB in Wigston, one of my areas in Leicestershire, OB, notably Southeast Asian ethnic background, Wigston, more maybe traditional white working class. I mean, sweeping generalizations, but I'll run with them. And there is an element of Wigston not understanding that their rates are as high as OB, but they pick on an area-based narrative and go, well, it's all the fault of that lot. And equally, as we saw with local lockdown, Leicester became something of a pariah, with Nottinghamshire police saying, we'll turn back people from Leicestershire. It said nothing about people's lived experience or their work patterns or their, the employment where they went to school. So area is almost like a bit of an IAM style conversation. I think, an area-based data drives an area-based narrative. And with things like tiering and indeed the Leicester lockdown, area-based data, I would also argue, drives area-based interventions, for better or for worse. I would recognise the good work that my Public Health England colleagues were doing with us around outbreak control. And to my mind at that stage, I'd also say there's a disjoint between some of the real data digging into the detail of outbreak control and sort of line listing, looking at ventilation, travel to work, shared buses, whatever, and the public narrative driven by area-based data. So I would recognise there was more data there, but there was a bit of a disjoint maybe in the public communication. So then lastly, from famine to feast, but I have an incident management team. We now consider data, not just the case data by age group, ethnicity, ward, etc. There's a few things I'll show you, but the detailed individual line list data from Public Health England on the outbreaks within our area, The role of local intelligence is absolutely key in this one. So the soft intelligence I get from district colleagues around what's going on in their patch is critical. That is also backed up by whistleblowers, people who do email me confidentially to say what life is like in their patch. Contact tracing data, common exposure data, which I'll show you a bit of, and also postcode coincidence data. And alongside other stuff, Google mobility data, and nowadays wastewater testing as well, where they're testing sort of sewage outflows for coronavirus. It really is, compared to what we had up until about September, an absolute chalk and cheese difference. The EPI reports we get from PHE, I mean, they're just fantastic. I've just included a few screenshots. I'm not naming the area, but just to give you an idea about what's in the EPI reports from PHE. This heat map shows the case rates per 100,000 population by different age groups. Sometimes it tells us a pattern, sometimes not, but actually having that level of detail about what's going on in different age groups is fantastic. Likewise, the index of deprivation stuff down the bottom, again, is very useful, although, you know, normally that maps onto geography. So again, is it deprivation that's driving this or where people live? But very easy to understand, very useful. But increasingly, I'm drawn towards stuff like this. So again, this is drawn, it's a snapshot of an EPI report. Again, I'm not saying where, which details the kind of exposures that come out from people when the contact tracing people ring them up and say, well, where have you been? Because this gives us more of a feel for the likely route of exposure. And you can see in this particular area, this gets into a land which I think is much more interesting than area-based data administrative boundary data. It starts to tell us much more at a glance around where people are going, how they live their lives, and potentially where the spread is. In this particular one, you might have your eye drawn, particularly in the weeks going to the end of last year, around the amount of cases which appear to be associated with shopping. Again, there's no necessarily direct link, but it's just fascinating that in the run up to Christmas, 60% of cases were associated with shopping in supermarkets. You can then relate that to your soft intelligence around mask wearing in supermarkets and you know, whether or not supermarkets are actually applying the regulations as they should be. If I took you to another district at the moment, I could see that actually workplace is up around 68%. So for that particular area, workplace is where it's at for me. And then this again is just a spreadsheet which puts that all together. I won't dwell on it because I'm just aware of time. But again, absolutely fascinating that you might, you would expect that you're getting into the detail of the 0 to 15s. 86% of exposure there is going to be school-based, even within lockdown. But if you come across to the working age population, particularly given the preponderance of warehousing and distribution within Leicestershire, if you know Leicestershire up the M1, you can see there that about 26% of exposures in the sort of 30 to 44 age groups being associated with one particular workplace sector. So really fascinating stuff. I'm going to skip through these because I probably just want to head for the reflection. So from my point of view, the data now gives us a rich picture. As I said, the EPI reports from PHE are really good, but they provide the start of a story, which we then need to investigate by diving into our own additional analysis, notably the soft intelligence. That local intel adds meaning to the local action, be it testing, comms, engagement, whatever, but it's still a position for me that the public narrative and the public discourse still comes back to this majoring on the place rather than the routes of transmission. So just to sort of enlarge that a little bit, the thing that fascinates me is if you look at, I mean, I talked about warehousing and distribution in a particular part of Leicestershire, knowing that that workforce is drawn from Derby City, Nottingham City, the bits of Leicester City where rates are highest, really says something to me about the routes that I would want to be communicating and have started communicating to the public far more about the causes of transmission are not necessarily to do with the place you live, it's the way you live your life. It's the behavior when you're in the supermarket. It's the behavior in terms of car sharing on the way to work. I'm not saying that these workplaces are unsafe, but you do start getting into a dialogue which uses data to actually pinpoint transmission and actually pinpoint where we're going. So actually, that's the last bullet points are actually left off the last slide. So there's that one. So concluding thoughts. The data journey is ever changing. It's a long one, but we're getting there. I would increasingly get into this kind of riff about how the placing of emphasis on place-based data has really driven the public discourse, the public narrative, and indeed the interventions that the government has then applied. We do start needing to get into a discourse with the public, which I think plays much more to determinants of health. We've seen that it was leaked in The Guardian, the enduring transmission document that talked about the importance of deprivation and workplace. But with the data that we have got that I think we should be sharing more often, I think we do need to get much more into talking about routes of transmission and area-based work. And like everything, I suppose 2 little bits from me to end in. I mean, data works best when it's integrated. So bringing together that local intel, qualitative data with quantitative is absolutely key. And then I haven't had a chance to go into it, but I do smile and just look at statistical literacy in the population. Now, I've got an E at maths, at A-level maths and stats. I'm not a brilliant mathematician, but the amount of time having to spend talking to people around case rates per 100,000, the difference of comparing apples with apples and apples with pears has been immense. And there is something in me would love to get back into a kind of school-based environment and really start talking to children about understanding basic stats. But that is probably the subject of an entirely different presentation. So I'm aware of time, so I'll pause there. Thanks, Dana.